Namaste. My name is Professor Michael Spedding. I'm the Secretary General of the International Union of Pharmacology, and I'm delighted to be indirectly here for SRIPS 2016. I was able to be at IPSCON 2015 at the Rajkot meeting, and that was a fantastic meeting, and I would have loved to have been with you today. However, I represent the International Union of Pharmacology, and on behalf of the President, Sam Enna, and myself, Secretary General, I would just like to welcome you to this meeting, which I can see is a very important and crucial one. And I see also that you've already had a small seminar and workshop on drug discovery and development, and that the meeting programme looks very exciting. So on behalf of Sam Enna, the President, and myself, we wish you a fantastic meeting. And that I want to say that the International Union of Pharmacology and the Indian Pharmacological Society are making an alliance. And with my friends Bhagirath Patel, Secretary General, and Dinesh Kumar, the President, we're hoping to be able to raise funds to be able to have some major initiatives which will help Indian pharmacology and also extend our network of contacts and scientists throughout the world to make greater contact and synergistic research programs to work with Indian pharmacologists and medicinal chemists. The program that we've set up is still in being defined, so I can't go into it in detail. But in IUPHAR, we think this is an absolutely major issue for us all, and hopefully for Indian pharmacology. I would just like to say a couple of words about the International Union of Pharmacology. We have got a large number of, I've got 60 pharmacological societies worldwide, and those pharmacological societies represent 36,000 pharmacologists. So this is an immense worldwide effort, which is bringing together knowledge in a freely available way via the web. Now, therefore, we have also many different subcommittees which can then specialize in particular issues and give recommendations to the World Health Authority or other groups. And we've actually published more than 100 papers with an H index of 76, which is actually equivalent to a Nobel Prize. And this is all done by cooperative effort given freely by scientists working throughout the world to produce websites which are then freely available to everybody. So we've got work on pharmacoepidemiology, clinical pharmacology in developing countries, geriatric science, pediatric science, drug metabolism and transport, education, gastrointestinal, immunopharmacology, pharmacology of natural products, and neuropsychopharmacology. And one of the main issues where we have been able to make progress, though, is with being able to define all of the drug sites in the human genome. And this is now available freely on a website, Guide to Pharmacology, which is being co-sponsored with the British Pharmacological Society, and we've been able to raise £500,000 from the Wellcome Trust. And this leaflet, which you should have available to you, describes the Guide to Pharmacology, which is just one click away for you to be able to see on guidetopharmacology.org, which you can do on your phones now, guidetopharmacology.org, that all of the sites of action of the currently available drugs that are present in the human genome. What is more, we've just raised another £500,000 to be able to have this extended to all of the drug targets in immunopharmacology and inflammation. Now, this is just ongoing, but it shows that the Wellcome Trust, which has funded that, recognises us as being a major source of information. How do we do it? Well, it's very simple. We don't trawl the data blindly using computers. We get experts. So that means that we have 700 world-class scientists working in 90 subcommittees who can then say which are the best targets, which are the best compounds to work on those targets, and then put this into either these very highly cited articles or alternatively into the data and in the database. And this database is a living function, and we much welcome you to be able to look at it. The social media attached, So if you go into Guide to Pharmacology, you can then be able to have a major source of information. What is more, we're then extending that into the Pharmacology Education Project, which will be a MOOC, a massive online resource, which will then be available in a few months for you to be able to see in terms of education. And we're working in Africa in order for this to be freely available. China, the Chinese Pharmacological Society taking it on, and the Australian, American, and also the British have obviously funded it to a major extent. And our Indian Pharmacological Society collaboration will therefore be very crucial indeed. So please look at this and then be able to use it in your day-to-day research. So we've got another major project which we're looking at, which we're getting quite a lot of leverage on, and that is the pharmacology of natural products. Now, natural products and herbal medicines are used throughout the world, and as the International Union of Pharmacology, we find it rather aberrant that on one side we have evidence-based medicine of new chemical products made by chemical synthesis, on the other, herbal products made from natural materials, but which have been developed over millions of years in sometimes chemical warfare between plants to be able to see, or corals, in order to be able to see how they can interfere with each other's development. Now that means that all of that's a tremendous richness, but we find it completely inappropriate that there should be a separation. And what is more, 55% of the world's population can't afford evidence-based medicine and uses natural products. So what we want to do is to bring that together and thereby produce evidence-based medicine using natural products, to be able to use preferably pure natural products, to be able to clearly define the modes of action, and then to be able to use these in the future in a very different way, and to be able to have one particular pharmacology worldwide. So with the Indian Pharmacological Society and this meeting today, we think we've got some major projects on board, and I wish you a tremendous meeting. And I am available via Skype to be able to meet with you perhaps. And it is one of my ambitions also as a pharmacologist, has been involved in drug discovery and development. My groups have been able to put 11 compounds into clinical trials, is to be able to make health projects for the world which are of major scientific import. And with the Indian Pharmacological Society and AUPHAR, I think we can do this. So, namaste, have a great meeting. Thank you.